Hey everyone! Welcome back to Learnify. Today we're diving into the fascinating world of cranial nerves, focusing on the oculomotor nerve, also known as cranial nerve 3. What is the oculomotor nerve? The oculomotor nerve is one of the 12 cranial nerves, and it plays a crucial role in eye movement and vision. It emerges from the midbrain and is primarily responsible for controlling most of the eye's movements, as well as the constriction of the pupil and maintaining an open eyelid. Functions of the oculomotor nerve. So, what exactly does the oculomotor nerve do? Here are its main functions. 1. Eye movement. The oculomotor nerve controls 4 of the 6 extraocular muscles. These muscles are responsible for moving the eye in various directions. The muscles it innervates are the superior rectus, inferior rectus, medial rectus, and inferior oblique. 2. Pupil constriction. It also controls the constriction of the pupil, which is essential for regulating the amount of light that enters the eye. This process is known as the pupillary light reflex. 3. Eyelid elevation. The oculomotor nerve innervates the levator palpebrae superioris muscle, which raises the upper eyelid. This is why damage to this nerve can result in drooping eyelids, a condition known as ptosis. Clinical significance. Now, let's talk about some clinical significance. Damage to the oculomotor nerve can lead to several issues, including double vision, because of the loss of coordination in eye movements, ptosis, drooping of the eyelid, pupil abnormalities, such as a dilated pupil that does not respond to light. These symptoms can indicate various underlying conditions, including diabetes, aneurysms, or trauma. Now we're going to learn how to examine the oculomotor nerve, also known as cranial nerve 3. It's an essential part of our eye function, so let's dive in and explore how to assess it. Preparation. Before we begin the examination, make sure you're in a well-lit room with your patient comfortably seated. Have a pen light, a visual target like a pen or finger, and a chart for visual acuity ready. Examination protocol. Introduce yourself to the patient. Take consent from the patient. Explain the procedure to the patient. Reassure the patient that he will be safe during examination. Eye movements. Start by assessing the patient's eye movements. Ask them to follow your finger as you move it in different directions. Observe for smooth pursuit movements and any limitations in eye mobility. Pupillary response. Next, check the pupillary response. Shine a pen light into each eye and observe the constriction of the pupil. This tests the pupillary light reflex controlled by the oculomotor nerve. Eyelid elevation. To assess eyelid elevation, ask the patient to look up while you gently lift their upper eyelid. Watch for any drooping or ptosis, which can indicate oculomotor nerve dysfunction. Accommodation reflex. Finally, test the accommodation reflex. Have the patient focus on a near object and then on a distant one. Watch for the pupillary constriction and convergence of the eyes, both controlled by the oculomotor nerve. In conclusion, the oculomotor nerve is vital for our ability to see and interact with the world around us. Understanding its functions helps us appreciate the complexity of our nervous system and its impact on our daily lives. Examining the oculomotor nerve involves assessing eye movements, pupillary response, eyelid elevation, and accommodation reflex. These tests help evaluate the nerve's function and detect any abnormalities that may require further investigation. Thanks for tuning in. If you found this video helpful, remember to like, subscribe, and hit the bell for more medical examination tutorials. See you in the next video.